Hello, everyone, and thanks for joining me for the third in our lectures in our community health course. This is Dr. DeFelice here, and today we're going to be talking about epidemiology. That is the study of disease, injury, and death in the community. So our objectives today are to define some important terms relevant to epidemiology, including the term epidemiology itself. We'll review some epidemiological history, discuss the importance of using rates rather than just crude numbers to describe the health of a community, discuss types of epidemiological studies, and review how some epidemiological data is presented in graphs. So what is epidemiology? Well, if you read the chapter, you'll see that the book gives us an entry point by comparing the field of epidemiology to the field of medicine. So in the example from the book, they say a physician practices medicine. The physician gathers information about the health of an individual, one person, via interview, physical exam, laboratory testing. There could be some other testing as well. Whereas the epidemiologist, instead of practicing medicine, practices epidemiology. And an epidemiologist gathers information about the health of a population, not the health of an individual, but the health of a population by asking how many, who, when, where. An epidemiologist can be thought of as practicing population medicine. So then, what actually is epidemiology? So we are given this definition. It is the study of the distribution and determinants of health-related states or events in specified populations and the application of this study to control health problems. Well, there's a lot going on in that definition, so let's break it down. So, study. Epidemiology is a basic science in public health. It uses quantitative data and scientific study designs to examine the relationship between exposures and diseases. Distribution. Well, epidemiologists search for patterns and the frequency or occurrence of diseases in the population. Where are they distributed? How many are distributed in certain places? Determinants. So one of the goals of epidemiology is to find risk factors, contributing agents, exposures, or causes of disease. These can be considered determinants. Moving on, we have health-related states or events. So while epidemiology is focused on infectious and communicable diseases in the past, this science has now extended to look at other diseases, including chronic illnesses, environmental health issues, occupational conditions, genetic diseases, mental conditions, injuries, and other health concerns. Specified populations. So we already said that epidemiologists can be considered population doctors because they focus on the total population and not individual patients. And sometimes the total population would be a specified total population. The population of a city, the population of a county, the population of people who work at a certain industry or something. So those would be the specified populations. Finally, we have the application. So the goal of epidemiology is to find useful information for the purpose of limiting undesirable health events and promoting positive health factors in the community. We do have some other important terms to know. We have acute disease versus chronic disease. So acute disease is a disease that lasts a few days to a few weeks, and this is like your high school geometry teacher used to say, "Oh, what a cute little angle," when they were talking about an acute angle, right? It's a very short illness. Whereas a chronic disease is a disease that lasts for more than 3 months. So Let's think of some examples. So an acute disease would be the common cold, right? The flu, something that you have it for a certain short specified period of time, and then you don't have it. Chronic disease, on the other hand, lasts more than 3 months. So we could say something like asthma. That's a chronic disease. A couple of other important terms to know. We have epidemic, which is an unexpectedly large number of cases of an illness, specific health-related behavior, or other health-related event in a particular population. We also have an outbreak, and an outbreak is an event that's similar to an epidemic, except that it is a limited geographical area. So if we think of things like a sudden increase of a disease in a particular area or traceable to a similar cause. You can also use the term outbreak to describe the occurrence of a disease in a place that doesn't usually see that particular disease. So here's just a quick table of some outbreaks and epidemics over the years in the United States. And we see there was, St. Louis encephalitis, Legionnaire's disease, toxic shock syndrome, HIV, West Nile virus, mumps, the H1N1 flu, pertussis, and e-cigarette or vaping product use associated lung injury. So that one's an interesting one. We see these words used a lot in the news. So this is from September 2022. An E. coli outbreak possibly linked to Wendy's has expanded to 6 states. Though the CDC said the specific source of the outbreak hasn't been confirmed, many of the people who got sick reported eating sandwiches with romaine lettuce at the fast food chain. So we see outbreak. So we can have an outbreak of foodborne illness. We have some other important terms to know. Endemic disease is a disease that occurs at an expected level in a population or in a certain location. We also have the term pandemic, which is an outbreak of disease over a wide geographical area, such as a continent or multiple continents. So we see these terms in the news a lot too. And so here is an article from 2022. It says COVID-19 could become endemic in 2024, study says. So that means COVID-19, it could just be an endemic disease that we live with, just like the common cold, just like the flu. It's endemic. So this is a great video on epidemics, outbreaks, and pandemics. I will put a link to that below. Make sure you watch that. And then I just have some review questions for you. So the first one is, what is epidemiology? Is it A, the study of vaccination, B, the study and analysis of the distribution patterns and determinants of health and disease conditions in defined populations? Is it the study of the diagnoses given to patients at return visits? Is it all of the above, or is it none of the above? Well, it is B. So you recall our definition: epidemiology is the study of the distribution and determinants of health-related states or events in specified populations and the application of this study to control health problems. Here's another question for you. What type of information does an epidemiologist collect about the outbreak of a disease? How many, who, where, when, or all of the above? Well, the answer is all of the above. Epidemiologists ask all those questions. Third question. When a disease occurs at an expected level in a given population, it is considered pandemic, epidemic, latent, endemic, or an outbreak. It is considered endemic. Remember, endemic means that a disease is occurring at an expected level in a community or in a given population. An epidemic, on the other hand, is an unexpectedly an unexpectedly large number, there's a little typo there, sorry about that, of cases of an illness, specific health-related behavior, or other health-related event in a particular population. A pandemic is an outbreak of disease over a wider geographical area. And an outbreak is an event that is similar to an epidemic, except for it's a limited geographical area. Here's another great video. I'm going to include it in the link below, showing how some very simple epidemiology solved a very, very complex problem way back in 1854. So make sure you watch that one. And now we're going to look at rates. So epidemiologists use rates. What is a rate? A rate is the number of events that occur in a given population in a given period of time. So we can look at birth rates, rates of disease, death rates, incidence rates, prevalence rates, and attack rates. Why are rates necessary? Well, rates allow us to compare health events from different times, different places, or among different populations. So if we look at this table right here, we see this is a table that says deaths and death rates for children aged 1 to 4 years by race in 2017. And our children have been divided into white race and black race. The number of deaths in each are, so white children aged 1 to 4 years old, there were 1,858 deaths in 2017. For Black children of the same age range in the same year, the number of deaths was 985. If we just look at those raw numbers, we don't get an accurate picture of, to compare. We don't get an accurate picture of how things are really unfolding. So when we look at a rate, let's just look down at the death rate per 100,000 population. So this tells us how many children aged 1 to 4 years died in 2017 out of 100,000 people. So for every 100,000 people, we see that 22.4 white children died. We see that for every 100,000 people, 40.1 Black children died. So instead of giving us just the raw numbers to compare, we have our rates so that this gives us a more accurate representation. We can directly compare per every 100,000 people how many children have died by race. And even though the number of deaths of white children exceeded the number of deaths of Black children in 2017, we see the rate is the opposite. The rate of Black children who died in 2017 outweighs the rate at which white children died in 2017. So there are some important rates to know. We have prevalence rates, we have incidence rates, and attack rates. Here, this bathtub is giving us an analogy of incidence and prevalence. So a prevalence rate is the number of individual cases of a disease in a population in a given period of time divided by the number in that population. So if we were just going to picture what our prevalence is, we can picture it as the water that's in the bathtub. However, if we wanted to look at incidence rates, incidence is the number of new cases of a disease in a population in a given period of time, divided by the population at risk. When we look at incidence, those are the new cases. So those are the cases that are coming into the population. The incidence cases can be seen coming into the bathtub. Only those are counted in the incidence rate. We have our prevalence rates and our incidence rates. There's also the attack rate. The attack rate is the number of people ill divided by the population at risk. So here is a great explanation of the bathtub analogy. This is another video. I will provide a link to it below. Next, we have some epidemiological studies. We have our book divides them into analytic and descriptive studies, although they can be divided differently and categorized differently. But according to our book, it says the analytic studies test hypotheses about relationships between health problems and possible risk factors. Descriptive studies, on the other hand, they might be the first epidemiological study to be carried out on a disease. So let's talk a little bit more about descriptive studies. So as I said, the first study when carrying out an investigation may be a descriptive study. These will describe a disease with respect to person, time, and place. These types of studies answer the questions who, so how many, young, old, men, women, both, when, it could be hour by hour, it could be year by year, it could be seasonal. Where, you want to know where. When you watch the video on Jon Snow, you'll see that where was a very important question to ask when he was trying to figure out the cause of a disease in a community. You can plot these on a map with natural and built environmental structures. And like I said, that helped Jon Snow narrow in on the source of a disease. So we also can represent answers to these questions in graphs. And so this is a seasonal epidemic curve, and it answers the question, when? And we see that this figure is peak influenza activity by month in the United States. So we have October, November, December, January, February, March, April, May on the bottom, and going up on our y-axis, we have a percentage. So we can see that in October and November, it's kind of a steady low level of influenza activity. It jumps up in December, goes down a little bit in January, and really jumps up in February, and then back down again in March. So we can track activity of a disease by month, the seasonal epidemic curve. We can also track really pinpoint common source or a point source epidemic curve. Tells us exactly the number of cases on the y-axis and on that x-axis hour by hour, right? So this is a point source epidemic curve. You try saying that. These are cases of gastroenteritis following ingestion of a common food source. So this is a foodborne illness, and we can see that between 6 p.m. and midnight, it looks like about 3 people were sick. And after midnight, our number of cases really kind of takes off, and it peaks at 6 a.m. and then it kind of just dies down again by 6 p.m. the next night. This one is a propagated epidemic curve, and this one happens to answer the question who as well as when. So this is in cases of chickenpox during April through June. And we see our index case right there at 0. That was a sibling or playmate that was not attending preschool. Someone else got it maybe it looks like a week and a half later. And then there was a preschool child that got it, and that would be the orange there. Then we have more non-school children presenting with the chickenpox. And then 14 days after the first preschool child got the disease, we see an outbreak in the preschool, right? So this is a propagated epidemic curve. So it means it's like one curve and then another curve, and then you can see your index case from the curve before, and then you see the next curve, and then it may kind of like peter out a little bit, or it may keep propagating. Where? So this will make sense to you after you watch that video on Jon Snow, but he marked down on a map where people lived who were ill, and their proximity to a certain water pump in the center of town helped him decide or helped him figure out where the disease was coming from, what was the source of the disease. We also have, in 2019, we have an EPA risk assessment for a facility that people claimed was spewing cancer-causing material. So the EPA did a risk assessment on this map, and they found that the facility is in dark blue, and they found that in that dark green color, 500 to 100 people in a million had a risk of cancer. And then as you get farther away from the facility, the rates go down. The light green is 200 to 500 lifetime risk in a million, and then it goes down to 100 to 200 lifetime risk in a million. So there we can see how a map might be able to tell us where to pinpoint the source of a disease. So I've got some more questions for you. Let's answer the question, why are rates important in epidemiology? Well, they allow us to perform a more accurate head count. Do they allow us to compare health events from different times, different places, or among different populations? Do they allow us to access a population's private health data? Or rates just aren't really that important at all? Well, the correct answer is B. They allow us to compare health events from different times, different places, or among different populations. What is prevalence? Is it A, the count of everyone in a community that does not have a particular disease? B, the count of everyone in a community regardless of disease status? C, the rate of individual cases of a disease in a population in a given period of time? Or is it the rate of new cases of a disease in a population in a given period of time? Well, the answer is C. It is the rate of individual cases of a disease in a population in a given period of time. So the prevalence rate of water in the bathtub is the water that is in the bathtub when I take this snapshot of time. Okay? Remember that incidence rate is the number of new cases of a disease. Okay? What type of epidemic curve is this? Is it seasonal? Is it point source? Is it common source? Or is it propagated? Well, it is a propagated one. Remember, the propagated one has like one hump, and then another hump, and then another hump. To review, a seasonal, a seasonal epidemic curve looks like this one on peak influenza activity. And then we have a point source or a common source epidemic curve, which looks like the one with the foodborne illness outbreak on the right.